With that, we'll go into our weekly update from our Public Health Director, Kathy McKay. I see you brought Cheryl along today, so. And as I've been listening to these reports and stuff, please speak into those microphones. We were having, I know I have problems when I listen to them that picking up when they're working with those microphones.
Thank you, Mr. Chair and Commissioners. I wonder if this is the mic that works better than that one. I'm not sure. It used to be that one that was kind of not picking up so much, but.
You pick up very good.
I think they're both fine as long as you speak into them. The problem is if there's a conference caller, that's the box that they need to hear. So
Oh, okay.
as long as no one's online.
Okay. Let me know if you can't hear me, but that's usually not a problem.
No.
So as we look at the numbers, you'll notice that, in Minnesota, we continue to rise with the positive cases, so 84,949. Now, the Commissioner of Health has reminded us that the increased case findings is also because the testing is increasing, the robust testing. Their goal was at 20,000 tests a day, so they're certainly meeting that and exceeding that on many days. So the fact that they're doing more testing, we're going to find more positive cases as well. So it's not to dismiss the fact that we have community spread also, so it's not just about the testing, but that is in essence why some of those numbers are increasing. In the number of deaths in Minnesota, 1922, and those no longer needing isolation, 78,238. So a number of the people are getting out of isolation. We call it no longer needing isolation because people aren't sometimes totally recovered. We have people that still have effects after they're done with their isolation. They still experience some effects, and we've heard cases where they have some ongoing symptoms after they've had COVID. And the positive cases in Clay County are 1,142. Our deaths remain at 40. One currently hospitalized that we can find in Clay County, so we actually have that number.
Thank you for having that number. I know we've
Well,
really been critical of that, and it's tricky to find it, but I think it's important for us to have that.
It's been a struggle to try to get those numbers from the hospital, so yeah, we're working on that all the time with our Red River Valley Task Force. And our 14-day case rate per 10,000 people, and that is the rate that the schools use to determine their level of distance learning or in-person learning. And so that number is 1576, and it had increased significantly since the last 10,000 or the last 14-day case rate. And that rate is August 16th through August 29th. Now, as you may have heard, we do have a number of cases that hit Dilworth, Glendon, Felton schools. That wasn't, the spread was not in classroom, but more about some group gatherings outside of that. So we had some of the team working with the superintendent and school board on Sunday to determine what they needed to do to change. They want to slow the spread, of course, and they have a number of more of the 7th through 12th grade. So they wanted to make some changes now and catch that before they have more numbers. Their numbers were high enough, so changing that learning model. We also have some numbers in the higher ed that we're following as well. So we're watching that closely. There's also someone assigned from Minnesota Department of Health that is also working with higher ed. So we have a liaison with K-12 along with us, Public Health, and then we also have a MDH, Minnesota Department of Health liaison with the higher ed. So we're all working together on their processes when they have some large numbers that are occurring on those campuses. Any questions with the K-12 or the higher ed? I also have the numbers of active cases, as you can see on this sheet, the grid that we kind of track, and we've changed the date a little bit to try and coincide with MDH getting more of those cases on the system that we use. And so we do have a larger number of active cases as of September 9th. So that's 196 active cases because the number of total confirmed cases increased as well. Now, as we state every week, we cannot get an accurate positivity rate for just Clay County. The positivity rate for Minnesota is, it went down, it was 5.4 and it's now 4.9. Because they get all of the negative, so they find all the negative and the positive cases. In Clay County, unfortunately, we don't get all the negative tests from the North Dakota side. So we cannot give a real accurate positivity rate for just Clay County.
I have a question.
Yes.
So Clay County, we closed the courthouse a while back, and now it is appointment only. And if you look back on the data, which is partly why I encourage you to have this data, so we can look back and see trends. If we go with the active cases of 196 in the county, and our previous high was, before September 2nd, was May 20th at 117. At what point do we pull back reins on maybe encouraging more remote work? Because I know more people have come back to the building. Maybe it's a question for Steve. I think it's important because the schools have a pretty set framework in terms of what thresholds will make them go hybrid or distance as opposed to in-person. And we don't have that. And so I think we need to have the discussion about when we pull back the reins or when we do more virtual meetings. I don't think we can see a peak and not be a little reactive to it.
Mm-hmm. That's a good question, and we do follow the Minnesota Department of Health guidelines, so they're aware of the numbers that we have in Clay County as they are in all counties. So at this point in time, they haven't, because we are doing remote. Now we might want to look and see how many we still have working remote and look at the numbers of employees. But they feel like we've done a really good job of doing appointments only, not opening up. Some of the other counties open their doors, and so people could just come and go, and we have not done that at the Family Service Center and also at the courthouse. So at this point, we're just going to watch those numbers. They have increased, but it's nothing that we need to change at this moment, but certainly we'll have more conversation about that and things that we should be doing. Any other points on that?
Do you have something to add there, Steve?
Kathy, I would just, and not to put you on the spot, Commissioner Moser mentioned in May we had 117 active cases. You indicated at the beginning of your presentation that there's now more testing that's going on currently than there probably was. Is there a way to determine that as far as the number of cases, number of testing that was done prior in May?
Yeah, and early on, like in March, April, May, it was a lot of the long-term care facilities and a lot of the congregate care facilities. Now, as we have schools, K-12 and colleges in session, we're seeing numbers go up, but the testing across the state is, the positivity rate is really the robust testing that Minnesota's doing. Now, we anticipate that we'll have a bit more testing. We haven't confirmed that yet, but we're working with Minnesota Department of Health on having a targeted testing done in Clay County. So we're working on a possibility to have the Minnesota Department of Health come. It's called the strike team. They would come and maybe do some testing 2 to 3 days to see a bit more about having more targeted testing in Clay County. So we're working with them on that. We don't have any of the details. That may happen in the next couple weeks.
Well, it seems like it seems like you say when there's more testing done, we're finding out more people that tested positive, So there's got to be a lot of people who aren't being tested that do have the COVID-19 that we're not even aware of yet, So even though you got figures here showing how many we've got, there's got to be, because if we do more testing, we find more. So there's got to be a lot more in Clay County and Minnesota and North Dakota, There's got to be a lot of people that have it that we don't not even aware of.
There certainly may be people that have it that we aren't aware of, that don't get testing done. We also don't know, again, there's a lot of testing with negative results, and that is some of what we don't have. So we don't have a lot of the negative results. North Dakota Department Public Health Lab is not able to get those negative test results to us based on just the logistics of doing that. It's not an easy task for them. They don't have an electronic system that matches with ours, so. But yes, if we have more testing, we certainly may find more positive cases as well. But they'd like to do a targeted testing in Clay County just to kind of have a sense of what our county is really experieing.
Well, that's why I think we just need to keep being cautious around there about
Correct.
wearing masks and stuff like that, because
Oh, absolutely.
if you're out in the public, it's just, we're just finding too many people that have it that we're not aware of, so.
But to go back to my point, if we're at an all-time high, and we know that, if you're saying we need to have more testing, then we'll know we'll have more cases. What I'm trying to say is, at what point do we have a threshold that pulls back the reins at the courthouse to reduce exposures?
Mr. Chair, Commissioner Mojo, our PIC committee has kind of led the way in some of the decisions that we've made as a campus, and maybe it's time in Kathy and her department's leadership, we could get together again and talk about establishing a protocol.
Great, thank you.
Yeah, just to follow up on that, it seems to me, right now we have 100 and whatever it is, active cases, and where they are, we don't know. We hear things about what goes on at, the universities. I'm assuming, I'm probably guessing somewhat that that's a significant portion of the rise. And again, I'm saying I'm guessing. But going to what Commissioner Mojo said, at what point in time are from our campus standpoint and our employees, at what point do we, if there's positive cases, to what level then do we do what Commissioner Mojo said, and possibly go back to working from home?
Yeah, and we certainly can talk about that. We can have more discussion about that. And like Steve mentioned, maybe we can talk with the PIC committee again. We're not getting an immediate, again, it's because, as Cheryl mentions all the time, it's a gray area. So Minnesota Department of Health is just saying, continue. As Commissioner Gross said, continue. We have to be diligent about wearing the mask, not continue our social distancing. So much of what's happening is out in the community. So many of the cases are out, even in the higher ed. It's not students in the classroom, but they're acquiring their cases in their social gatherings.
Right.
And that's also what we experience in K-12. So it's a lot about the socialization that people are doing in large gatherings, not masking, and in close proximity with people, closer than 6 foot, longer than 15 minutes. So that's where we're seeing a lot of the community spread. So for the public, we want to emphasize that's we have to be diligent. I mean, people get tired of wearing masks, but that's our best method of protecting each other, as well as the social distancing and not gathering in mass quantities of people. So that's where we're seeing a lot of the spread. So we'll certainly have more conversation about that.
Mr. Chair, I have one more question, if I may. Thank you. Do we have any employees that have tested positive throughout this ordeal?
Yes.
Okay, so that goes to my point of, if we are at an all-time high cases that we've seen, we've already had employees test positive. It seems to be the responsible thing to do would be to reevaluate the amount of the public coming into this building.
And I'll say, yes, that's a good point. All of the cases that we know of so far have been acquired outside in social gatherings.
And
It doesn't diminish the
we have a quarantine
fact that we-
process and all that here too, correct?
Oh, excuse me?
We have a a process in place of quarantining.
Correct. Yep. And each employee that we've worked with, and we work with each one, they're following the guidelines exactly as they're supposed to.
Okay. Cheryl? you got-
So on top of all of that, we are coming upon influenza season. You may have heard on the national news that there's many medical providers that have high concerns about this with the cases of COVID that are occupying hospital beds and ICU beds. Then we have influenza. So according to the CDC surveys, only about half of Minnesotans get a influenza vaccine each year. And in order for us to reduce the impact of COVID on our healthcare systems, we need to increase that number of Minnesotans that get their flu shot this fall. So we have started getting our influenza vaccine here at Public Health, and we have been talking with some of the senior centers like we normally do each year about how we can get those folks vaccinated. We'll be offering it also to all of our county campus employees as well. And there will be more to come in the next couple of weeks. We'll be setting something up. It'll again be by appointment because we do not want to have people congregating, and we'll be able to send out the form so our county employees can fill that out ahead of time with their insurance card information and everything. So there'll be more to come.
On this flu shots, I know some of them, they're already getting them now.
Correct,
Is there a
yes.
certain time you should get, should you wait till October, November, so it lasts longer, or how long do these flu shots last? Or
Well,
don't we know?
generally, your medical provider would be the best person for you to ask that question to. We know that folks that are older, their immune system is not able to hold that vaccine immunity within their system as long as, say, a 20-some-year-old.
Were you looking at me when you said old?
I know.
Okay, go ahead.
Yeah, with the 20-year-old.
I'm not pointing you out, Mr. Chair.
He's German, he has got one heck of an immune system.
I'm German as well, so we're in there. There's many opportunities to get your flu vaccine through the medical providers, our healthcare systems. I have not seen it yet, but I'm sure Essentia and Sanford will be announcing some type of opportunity there. And of course, many of the pharmacies are offering them, and then also we will be offering them as well.
But just to further clarify, the medical providers are providing currently right now flu vaccine for those with health conditions, underlying health conditions. So it should be effective throughout our flu season. Typically, we start our flu shots in October, but they're starting them now because we have COVID vaccines that's going to be arriving. So we want everyone to get the influenza vaccine prior to getting COVID vaccine. So now is not too soon to get your flu shot for anyone.
Well, there's no such thing as getting two flu, say like getting one in September and getting one in March?
No.
No,
You don't do twice?
Nope.
Okay, thank you.
there's no booster for the influenza vaccine, just the one time each year.
Okay,
That's too bad.
Yeah.
all right.
Any other questions, comments?
Mr. Chair, if I could, one of the things that Kathy's mentioned in all of her updates is that they're working closely with higher education. As the kids have come back to school, one of the problematic areas that have been identified are the college areas. And I just wanted to acknowledge the work that the public health is doing. Specifically, if you read the paper this past week, Cheryl was singled out by one of our universities for the knowledge and the great work that she and her staff and Kathy and her staff do. So I just wanted to point that out.
Thank you very much.
Mr. Chair and Kathy, just a suggestion here to maybe to help kind of get the word out on flu shots. Maybe we should, during our meeting coming up real soon, give them to all of us commissioners as a public, I mean, at least those of us that want them.
Give a shot?
I certainly do, yeah. Yeah, we can have a shot in the
Remember,
morning.
Commissioner Campbell, I used to come over and do those.
Yes, yeah, we did do that.
And we can certainly do.
Yeah, but I
that.
just think from, because we have this televised and it goes online, I think that to help with the public awareness, I think it would be good to do that.
It's a great
I'd-
suggestion.
I'd be
Excellent.
more than willing to,
There's no one that faints, this there, that, okay.
I'll have Kathy with, so
Grant
she.
prize.
I'll grab you if you faint. Great suggestion, Mr. Chair, Commissioner Campbell. We can certainly arrange that.
Absolutely.
good.
Thank you.
Okay. Thank
Okay,
you.
thanks for the update.
All right, thank you.